Hi everyone, my name is Winton and today I'm going to inform some information about ads and here's my audience. So, um, according to the Global Health Observatory data, there's about 1.1 million people worldwide died due to AIDS in 2015, even though the number was 26% lower than the number in 2010. We do not have much time or room to self-conduct it. The clock is ticking and we have to end AIDS epidemic before it becomes a public health threat. Although we are not a doctor or medical student, it doesn't mean that there's nothing we can do to help stop AIDS spread. I learned about AIDS from my physical health class and I also did some additional research for this speech. Today, I'm going to inform you about AIDS in three aspects: the definition, the symptoms, and the transmission. Before we get in further, some basic background information about AIDS should be mentioned. So, according to the Center of Disease Control and Prevention, which is the CDC, the definition of AIDS is that a specific group of disease or conditions that are infective of several immunosuppressions related to infection with HIV. A lot of people think that HIV and AIDS are the same thing, but with different names. However, there's a huge difference between them. HIV is a special kind of virus that will lead to AIDS. AIDS is a disease caused by infection of HIV. It doesn't mean that everyone who infected with HIV virus will have AIDS. The incubation period of HIV virus in the human body is about 12 to 13 years. Before becoming AIDS patients, HIV virus carriers look normal and they can live and work without any symptoms for many years. After understanding the definition and other background information about AIDS, we are moving to the symptoms of AIDS. There is one thing cannot be ignored, that neither HIV virus or AIDS is deadly itself. The lethality comes from virus disease infects after the immune system is destroyed. AIDS will have different symptoms in different stages. During the first stage, people may develop fatigue, fever, swollen glands, and possibly a rash. These symptoms may disappear with a few weeks, and people usually will not think about HIV infection or having AIDS. Many people continue to feel fine, though some may have chronically swollen lymph nodes. During the middle stage, many people will still feeling good and without any symptoms. However, the destroy of the immune system has begun. On the last stage, patients may experience weight loss, laxity, and recurring fever. As the last stage progresses, the immune system collapses. The continuous and complications of compressed immune infection are many, and death becomes a matter of time. AIDS cannot be cured by current medical technology, so prevent having it by knowing the transmission becomes more and more important. After years of research, people find that HIV virus can only be transmitted by three methods. The first method is having sex with infected person, including oral, anal, and vaginal sex, especially heterosexual sex. The second method is sharing drugs, needles, or injectors with an infected person. This could happen when people donating blood at irregular blood donation points or using illegal drugs. The third method is menstrual transmissions to a baby at the time of birth and through breast milk. That is why it is important for people to do a health test before deciding having a baby. So in conclusion, having a better understanding of ads can not only help yourself keep away from it, but also help us to stop the ads spread. Even though ads is highly deadly, it can only be transmitted by the three methods I just mentioned above. So do not be afraid or discriminate people who is found as ads. So thank you everyone.